Hello. A lovely good evening, sir, and a lovely good evening to all the dear doctors who are watching this session. Uh, Dr. Rajiv Dhawan, sir, a very, very warm welcome for this small session for our students who are going to appear for 12th of December 2021.
Absolutely, sir. Good evening, sir. Good evening, everyone. And sir, just to confirm, sir, are we on the YouTube? We are live. Just if we can check that.
I'm not able.
Is the audio video okay, everybody? Mm-hmm. Guys, give us 1 minute more. Yeah. Okay. Yes. Perfect. Yes, sir, we are on the YouTube. The students are writing that everything is fine. Audio video is fine, and a warm welcome to everyone and good evening. And this will be a brief session. This will be a quick session, and it will be a practical session, So I welcome Dr. Vineet to this session, and I choose to host the session. And who can be the better person to tell us that, about this session? What is the thought behind it? The most important thought behind it is that all the FMG students who are appearing in this exam on 12 December should feel that the faculties can also live the emotions we are going through at this juncture. That's the most important thing. And why it is important? Because we as humans always feel more at ease when we have someone behind us. It's like that, that there's someone who is also understanding that what I'm going through at this moment, that is a moment in which we feel a little peace and little, at ease also. And in that state of mind, you guys would appear in the exam in a more controlled, structured manner. And that is the humble attempt on our part. So this is what the thought behind it. So Dr. Vineet, please start the session.
Yeah, thank you so much, sir. And very well said. We are just here for the foreign medical graduates because we are also almost going through the same emotions. And we can really understand the pain, the anxiety, the nervousness, the palpitations, what they're having at this point of time. So broadly, what we are planning is that we just want to share your emotions with you and just to calm your nerves as much as possible what we need to do the night before. And I think nobody can be a better person than Rajiv sir himself, that how you have to mentally prepare yourself, at least the night, starting from night before the exam. Then we'll be focusing on what timelines basically we can follow, how to behave, what should be our attitude in the exam, and how to deal with the different type of questions, maybe some bouncers or googlies, or so we'll just share our experiences. Yeah. So Rajiv sir, if I may take the privilege to ask that looking at the current mindset, what the students are going through at this point of time, they are really having a lot of nervousness, the palpitations. The common feeling is that they're not able to remember the things at this point of time, and how they should first control this, and then we'll move on to the night story.
So thank you, Dr. Vineet. Let us take it right from now. We are approximately 72 hours away from the exam. You can say that 3 days are there in between. And tonight also we are counting. And first of all, in these 4 nights, choose to lie down. I'm not saying sleep, because sleep will be a too much thing to ask for. I know that, because we get restless more towards the later part of the preparation, and this is what we are. 4 nights are still left actually, and I would say please choose one of these options to lie down, to take rest. Either it can be, you can say 5 hours sleep is required, 5 hour rest is required, I would say, and you can choose 11 to 4, or you can choose 12 to 5, or you can choose 1 to 6. Maximum, everybody should be awake by 6 a.m. in the morning in all these remaining 4 days. Actually, there are 4 nights, so make it a habit. You say, Rajiv, I have a habit of studying till 3 a.m. and I get up at 8 a.m. That we have to control now, because why I'm saying is you need to be super active between 6 a.m. to 5 p.m. So that let us now adopt that sort of schedule. And a night before, now night before means Saturday night, on the night between 11th and 12th. Believe me, it's very easy for us to say, or faculties to say, have a good sleep. And if I'm really able to recall my exam night before, just before the exam, it was not a very sound sleep actually. It was not a sleep actually, I would say. But yes, there was a physical rest. Actually, sleep has got a huge element of physical rest also. You understand? There's a mental rest, there's a physical rest. So at least lie down. I can't say that have a sound sleep, because that would not be practical, because a lot of thoughts start coming to your mind. What if I score 149? You see those figures of 149, 148 in the air also. So that is going to be there. But lie down on a chosen time frame, 11 to 4, 12 to 5, 1 to 6. Either of these three, whatever you want to choose, just lie down, and just you keep tussling over the bed. But maybe for 2-3 hours, you will get some sleep, and that is sufficient. You trust yourself. Being human doesn't mean that you have limitations. Being human means that you can stretch to a lot of capacity. Do not think that if you did not get a good sleep a night prior, your day would be really lethargic. This is a day like a war day. On a war day, adrenaline is going to really pump out something out of you. Don't worry about that. So don't think, if I don't get good sleep, how will I perform the next day? That doesn't happen like that. On that day, the body is going to really, keep you into a war zone kind of performance. So you would be anyway active. You just need physical rest. And in between that, maybe 1 hour, 2 hours of sleep when you are off your everything, that's okay. But nobody should really expect to have a sound sleep in these 4 days. That's not practical. But take rest on a selected time out of these 3 options, actually. Mm-hmm.
Wonderfully said, sir. So just a crisp message that you definitely try to sleep. And if some of you are able to get a good sleep, that is really a bonus for us. But even if you're not able to get a very, very good sleep, then what Rajiv sir has mentioned, that please do take that physical rest. That is going to be really, really crucial. So try to sleep for 5 hours, 6 hours, or if possible, if anybody can sleep for 7 hours, that would be really, really a bonus at this point of time. And
yes, absolutely. Whatever you can afford to, but minimum, I'm saying minimum this much is definitely. Don't really be a hero on that day. Sir, I'm studying till 4 a.m. in the morning. I got up, and at 6 a.m. I started getting ready for the day. That would not be a good thing. You just be off some 5 hours, just be off everything that's required for sure. So may I ask you now one thing? What are the instructions you would like to really share with all the FMGs, that what document they should carry, what time they should reach the hall, what should be their mindset in the morning actually?
yeah, so I think I would just check this, and if we have got something here, just a second. Yeah. So I would just like to highlight a few points over here, that the admit card, what we have received or the students have received till now, there are specific instructions. So I would request all the foreign medical graduates to please have a look at your admit card, beta. Just read the instructions carefully, whatever is mentioned there, because that is what the NB people would be asking from you. The crux message which I can share with you is that the entry in the examination hall is going to close by 8:30 for paper 1 and 1:30 for paper 2. But it is highly recommended that you should not delay beyond 8 a.m. in the morning and beyond 1 p.m. in the afternoon, because there are few hassles which might take some of your precious moments. So it's better that you are inside at 8 o'clock in the morning, right? That means your target for reaching the examination center should be 7:45 in the morning, and then 8 a.m. you are inside the examination center. Then there would be some formalities like maybe the temperature check and other things. Please remember the document which you have to carry. Do not forget the original admit card. The admit card which you have, that is the first document. Number two, your original ID proof, which you have uploaded as the documentary evidence while filling up the application form. Okay, beta? These two things very, very crucial. Please remember this. You don't have to forget this. Your original admit card, the ID proof which you have submitted at the time of submitting your application. And for those doctors who might have got some mistake in their spelling of the name or surname or something like that, please do also carry an original ID proof which is having the same spelling as you are having the spelling on your admit card. That means if there is any discrepancy in the name on the admit card and the ID proof which you are carrying already, please do carry additional original ID card. So there are three documents.
Perfect.
And you are not allowed to carry any other thing with you. All of you have to wear the mask. That is 100% mandatory. Mask is very, very important, beta. Very, very important. You cannot forget your mask, right? No other article, whether it is your watch, pen, pencil, or water bottle or anything, nothing is allowed inside the examination hall. So no other document has to be carried.
But Vineet, one thing I would like to really say from my own experience, when you're wearing the mask and you have got specs like you and me, there is fogging actually of the screen of your lenses. So what I do is I just put a tape on that mask so that you are able to comfortably wear the mask without fogging of the lenses actually. So you can just put a tape just to keep it over like this and just wear the mask high. There's no, and you should be absolutely comfortable. You can't remove the mask because they won't allow you. So you have to make sure that you are absolutely comfortable in the mask. So choose, keep one extra mask and just tape it over here. It will prevent the fogging of your lenses. So you'll be comfortable that way.
Perfect. And one question which is being raised by the students is that what should be done for the COVID-19 testing, the RT-PCR or the RET or something like that?
Yes, sir. As we discussed also, there is no mention of COVID testing this time on the admit card. There is no instruction as of now by NB for the COVID testing. Last time they had commented the testing of this nature within this much time actually. So they have to be specific about it. So as of now, considering the admit card of the day, I would say there is no guidelines to get the test done. So just hold on, but keep a watch on any NB updates. If there's any NB update, we will also post on our various channels. You just maybe till Friday we'll get the idea if they want you to get tested. Somebody said that if we have vaccine certificate, shall we keep it? No harm in keeping that. There's an extra paper, you can just throw it if they don't need it. But all these things you can keep this to have a mental sanity that okay, I have it in case they ask it. But testing wise, as of now, no instructions. But any instruction coming on your email, just keep checking that. Otherwise, we'll also inform you whenever such kind of update comes.
Yeah, just to add on, sir, one here.
Yeah.
The National Board of Examination, like I remember with my past experience in 2020, that in the night they sent an email to the students the night before the exam, stating that this particular student is supposed to reach at this point of time in the examination hall. So just to make a bit clear that please check your email in the morning when you are waking up or before you are going to bed on 11th night for any update from NBE or maybe your SMS. If there is anything related to the time of reaching to the examination center or maybe any other document if they want, like Rajiv sir is mentioning that by Friday night we should be getting any update if they are giving any update for COVID-19 and all. So please do take care.
Sure. Wonderful, sir. Sir, let us come to the exam day, because that is the day which people have been preparing for, and the lot of question in everybody's mind. So I would ask you that, as you very beautifully told, that we should not delay anything. Like what I can understand as a student from you, we must keep our things ready a night prior. My one ID card which I uploaded is ready, sir, with me. I'm checking as a student with you. I have kept one additional ID card with me just to safeguard my any last minute hassles. Number three, I have kept the things whatever I require. My dress is ready, everything is ready. I'm not forgetting. I'm not carrying unnecessary things, so that last moment I get a hurry that where shall I keep my costly watch? Maybe you have a very costly watch, maybe like my Apple Watch and all that. So don't do anything which they're very clear. They're very clear in that. And reach on time. Reach on time. Do not let anything create undue anxiety on that day, because let us be as channelized on that day as possible. So as sir said, 8 o'clock must enter, 1 o'clock must enter the hall. Let us be there and let's relax over there. Okay.
I also want to re-emphasize it very clearly, sir, because we have
so in last 12, 13 years, I think you and me have seen last moment people say, oh, I don't have my passport. I said, how? So we have seen that. Let us learn from those things and let us not do anything which can really, take our focus away from the exam. We want each cell of our brain, neuron of the brain should focus on the questions, not that just now we dealt with the issue and that really. So I hope it is clear to everyone that this is very important thing, okay? So that we are at ease as much as possible for the exam questions, sir.
Now, timings, the NB is very punctual, sir. They will not.
I think they are very punctual. I have been to the halls. Yeah, you're right, sir. They do not allow, and then they do not allow. You know it.
Do not allow means they do not allow. Nobody can enter inside. So please speak about the timings.
Absolutely. So now let's come to the exam day, sir. Real thing. So let us, guys, now I'll just take 2 minutes, because let me start the desktop, and I am having the first question on the screen, and from there the story starts. My heart is actually right now at 110 beats per minute, and I am having already palpitations are on, and what really is going to go through. Now let us live that emotion, and may I remind all of you that bache, every third question of the exam, I'm sorry to say this again and again, this is not right to say on a platform like this, but let me inform you so that you know this is going to happen. Every third question of the exam would be shaking you from within. Maybe it's every third question, or maybe 3 questions in sequence. I'm being out of 300, 100 question will be really too tough or not at all known to you. In spite of this kind of feeling, we will comfortably pass the exam. The most important thing I would like to say to you, you are not there to prove that you know everything about everything. You are there to score 150 out of 300 and pass the exam. Consider this as a pond. On top of the pond, there are a lot of, there's a lot of scum that, green algae we call, spiral. I don't know if I remember that. There's a lot of algae over there. You know what? And we get scared seeing that what actually is going to really be beneath it. This green algae cover, which is not really, attractive to you, is actually 100 question. But below that, there is a pool of 200 questions, which you know. So you have a choice to make now. You want to get scared by looking at this green scum cover of the pond, or you want to deep dive and bring those 200 questions out and pass the exam. So whosoever is listening to us right now must make sure that this is clear in my head. On the exam day, I'm not going to really have this feeling that I'm knowing everything about everything. But I'm going to get this feeling that I know a couple of things very clearly. I know some of the things a little bit. I know some of the things not at all. This is the mix. But with this feeling, I can comfortably pass exam. So the most important thing from every 4 nights, tell it to yourself. I do not know everything about everything, but I know sufficient enough to pass the exam. I do not know everything about everything, but I know sufficient enough to pass the exam. And may I say it again so that it goes into your cerebrum. I do not know everything about everything, but I know sufficient enough to pass the exam. Only thing is, I'll be not focused or scared by the unknown stuff or the partially known stuff. I will deep dive into the paper. I'll bring those, pearls of 200 question out, which I know surely or I know mostly, and I'll score 150 and pass the exam. So that's the one thing I would really want you to really take as a clear thing, at least for my learning, for the FMGs. Yeah.
Wonderfully said.
Yes, sir.
And I also agree with this. And again, just re-emphasizing what Rajiv sir has communicated, it is not necessary to know everything about everything, but you all know sufficient about the things to crack this exam. Have that feeling inside you, have that confidence and faith inside you.
Wonderful. Sir, I would say that, sir, there are different varieties of question in the exam.
Yeah.
I would like you to give tips to the students how to tackle different type of questions. That would be a wonderful thing, guys. Make a note of what sir is going to say in your head, and this is going to help you in the exam. Okay. Yes, sir.
Thank you so much, sir. And this is just a small slide which we have prepared as faculties together. The entire MIST faculties have prepared this for you. If we take a look at these important points, read every word in the question carefully. Please pay attention to the words like false, true, not, incorrect, except. These are going to be important words, beta. Now there are different type of questions which we all together have tried to summarize that what should be our approach. There would be some single liner questions, beta. Do not waste too much of time on the single liner questions. Mark the answer and move to the next question and save your precious seconds which you have to invest in other lengthy questions. For a lengthy question, read the last line and the second last line of the question. Look at the options, try to figure out the answer, and then read the question before marking the answer. Number 3, for image-based questions, see the image, read the last line of the question, then look at the options, and then read the question, and then mark the answer. So just trying to tell you the 3 important things here: single liner questions, the lengthy questions approach, the image-based questions approach, and then if we further take a look at, there would be clinical conceptual questions also, beta. Now these are just conceptual stories, and we all as faculty team of MIST believe that your teachers, whatever platform you have chosen to, your teachers would have given you sufficient concepts. So just try to apply those concepts in these conceptual clinical questions and then mark the answer, because they are also going to give you a very good impetus in your final scoring. Number 5, for questions which you do not know at all, we have been telling you, beta, just mark the most beautiful answer. We would just like to remind you, beta, that in these type of questions, you can spend 10 seconds at the options. Just look at the options. Try to apply the rule of exclusion. That means suppose there are in the 4 options, suppose it is a question from microbiology and you don't know the question at all. But by looking at the options, you feel, oh, there are 4 bacteria in the options and 3 bacteria are gram positive and 1 is gram negative. So since you do not know about the question and the answer at all, you can just try to apply the rule of exclusion there and mark that gram negative story. Or maybe there may be 4 options, out of which 3 are capsulated bacteria and the other one is non-capsulated, something like that. So just spend 10 seconds there. If you feel that you are able to figure out, mark the answer and then move to the next question. Do not leave any answer or any question unmarked. Also, beta, I would like to remind you that if you have got doubt in any answer for any type of question, beta, whether it is a single liner question or a lengthy question or an image-based question or a clinical conceptual question or a question which you do not know anything about, if you are not sure about the answer, please do mark the answer, whatever is coming to your mind, and then flag that question for review. Flag that question for review so that you do not miss out. This is only because we have seen sometimes that students, by the time they reach the 150 question, the time is short, and they left few questions in between unmarked because they thought they would be coming back to this question again. So I think this would be a better approach to go for it, sir.
Great, sir. So can we stop the screen sharing, sir?
Yes,
Yeah.
please.
Guys, that's a very, very beautiful summary of all we have been talking in all these, months with you guys. And what I learned as a student, if I'm appearing on the exam, what I learned from Dr. Vineet sir, bullet points. Number one, if the question, like he says, very, very useful thing, long questions scare us. So he says, read the last line, read the choices, and read the upper body of the question later and just mark it. There's one more learning I would like to share with you over here is, do not change your answer again and again. This is, you would have seen in your mock test and all that, when you retrospectively review, oh, I marked it correctly, then I overthought about it, and then I changed the answer to something else and it went wrong. So let us pledge today, single liner question or the question you are sure about, you read this question, only abductor muscle of the larynx is A, posterior cricoretinoid, lateral cricoretinoid, cricothyroid, or the vocalis muscle. Now abductor, posterior cricoretinoid is the only abductor. I'm sure I'm not marking lateral. I'm sure I'm marking posterior. A is the correct choice. A is the correct choice. Khat. Never go back and start dissecting this question again and again. So do not put too many questions for review for flag. Yes, you can flag, but as Dr. Vineet said, must mark one answer at least and then only flag. None of the questions should go unattempted because there's no negative marking. Why should we leave ourselves one chance? Maybe that we are correct. We may review it. We may come back to it in the later part, but we should attempt all the question in first go only. So as Dr. Vineet is saying, I'm a student and I'm saying that, okay, I started from the first question and I went up to 150. None of the question goes unattempted. Some of the questions are flagged. At the end of the paper, I would come back to those only review questions and unflag them one by one, and that's all about it. Okay, so the image-based question, look at the image first, of course, and read what is asking. Is the name of the sign or clinical diagnosis, whatever. Then read the upper body and come. But look at the keywords your faculty told you. Keywords, every faculty, every institute would have, everyone tries to do the level best to, put deep into your brain what actually is the key point. Please do not over dissect. It's a screening exam, beta. They don't want you to make a rare diagnosis. Please understand it. Sometimes we overthink and we start analyzing like a super duper DM cardiologist, and that poor chap is only asking atrial fibrillation. You know what? Why to really go for bundle branch block and all that when you know it is atrial fibrillation? Have faith. It's okay. Fibrillation or flutter. That's all. His main idea is that. So generally question rotate. Like I remember there is such a big question in general surgery. I remember when my mass says, but one word is written, a child and red currant jelly stools. I remember that, the answer of this question, I know it's interception, sir, if I'm correct, sir. This was such a 1 kilometer long question. I tell the 1 kilometer long question, oh, red currant jelly stool, why I'm bothered here? I know it is interception. Howsoever you may try, you can't put anything else over there. So you may have read, oh, rare symptom of the rare disease can be also this. Please don't go that route, beta. That is not the aim of this exam. The aim of exam is screening that you are knowing the more common things in a confident manner. That is all actually. Okay. Now let us go, sir, one step beyond. For the unknown question, Dr. Vineet today, gave one very beautiful thing. The concept of exclusion. And this is applicable just not for unknown question, for partially known question also. Let me tell you one example today. Rene negative is seen in all except. Rene negative is seen in all except. God knows what is Rene negative. What is Rene? What is negative? What is all? What is except? I don't know that. Rene negative is seen, but at least I've heard the word Rene. All except A. He says that A, wax in the ear. B, CSOM. C, glue ear. D, he says that press by accusis. Okay. Now I know, I don't know, Renee, what is negative, positive. I'm unable. Is my exam going on, Dr. Dhawan? It's not like you are sitting in a drawing room and having a coffee and, you're upping there. It's my exam going on. My heart is, having, right now, so many, sort of flutter and fibrillation right now. And you're saying Renee negative is seen in all except now. But I know that VEX is conductive hearing loss. I know glue ear is conductive hearing loss. I know CSM is conductive hearing loss, but I know presbyacusis, age-related hearing loss, is something about cochlea and nerve. It is sensory neural hearing loss. So this is what Dr. Vineet is saying. Even if you're not able to recall that thing perfectly, but these three things are conductive hearing loss. Only presbyacusis is sensory neural hearing loss. So Renee is negative in all except, I don't know, I'm not sure, but this choice is sounding pretty different actually. Let us mark that. So this is Dr. Vineet's very good message. And I would also, say, the most beautiful choice belongs to when you don't know the question, when you've not heard the answer also ever. Like for example, cryptogenic gene gamma 123 is linked with. I don't know what is cryptogenic gene. Gamma 123 to bahut dur ki baat hai. Choices bhi aise hai. Hand-Schuller Christian disease, histiocytosis X, D. Mondini's dysplasia of cochlea, and E. Alexander's dysplasia of cochlea. None of them I have rarely heard. I don't know what this gene is all about. I don't know what these stupid syndromes are. Then may I recall you the Ragra-Patty syndrome. This is the real Ragra-Patty. Where I say, look at the question, think about, look at what is the most beautiful choice in your mind, mark it and go ahead. The exclusion would be really, at least you have heard those choices. Okay. So wonderful thing really getting amalgamated over here for you to have peace. Okay. How to tackle such kind of situations as well. Okay. Dr. Vineet, sir.
Yeah, I think very, very nicely said, sir. And I think we both have tried to summarize the approach for different type of questions and what you have to do for Ragra-Patty syndrome. Sir has clearly told you, beta. Please save your precious time. Please save your precious seconds. Now, sir, I think we are having few questions. What I can see, like there are questions, for example, whether it is possible to flag the questions and review them later. This is Alphatul who is asking this. Another question is from Sai Krishna. Are we able to zoom the images in the exam? Then there is a question from Entamiba who says that what should be done for the next 3 days and so on. So what I personally know is that it is really not possible to zoom the images in the exam. So basically we have to just answer according to what we are able to see on the screen. Sir, please, your thoughts.
Yes, you can always flag the question, as Dr. Vineet said, and can come back to it and unflag it. But do attempt the question, as Sir said that. As far as the Zoom, the image zooming option is concerned, I think there is one, sort of zoom point given next to the images sometimes, and you can zoom it. But generally, images are having sufficient size for you to make a diagnosis or whatever they want you to comment upon. And anything we are missing upon, sir?
So there are a few questions like the students are really forgetting. They're not able to recall. They're not able to remember. They're getting that cramps, the frustrations because of this. Then there's a question from Pari. We are coming from very different part of the area to the center, and center is too far from our home. To make good contact or navigation purpose, we will bring phones, but where we can keep that. So I personally feel that you should be having somebody, maybe some of your friend or someone who can keep your belongings with you, because you would also be carrying some small things for reviewing in the break time. So please give that to the person who is coming along with you. Or maybe someone who has come with your friend. Then I think COVID, we have already answered that as of now there is no update. This is a big butterfly in many of the students. Devyanshu is asking about it, but as of now there is nothing mentioned in the admit card, so we should not disturb our focus at this point of time. These are the few things, beta. If you have got anything else, please do write in the chat box so that if we are able to answer on the basis of our experiences, we would be really glad to do that. And another common question which is coming up from Madan and others, that what should be done in the last 3 days.
Yes. So we have already covered the documents to carry. We have already covered the COVID question, which people are writing now. So what to study in the break times? That is the one question, sir. Break time. What to study in the break time, sir?
Sir, in the break time, the students would be finishing the paper one at 11:30, and by the time they come out of the examination center, it would be 11:40 or 11:45. Then they have to make sure that they have to re-enter the examination hall before the clock says 1 o'clock. That means 1 hour 15 minutes. In these 1 hour 15 minutes,
Yeah.
try to calm your nerves down, try to relax yourself as much as possible, and just have some light snacks. Also, please have a look at the images like derma, ortho, radio, surgery, gynae, ophtha images would be important. Then you can just have a look at some single liner points or maybe the highlighted points if you are carrying something, some pages with you. I think this is all we can do in 1 hour 15 minutes at that point of time.
Yes, sir. So one thing to add upon for everyone, which is in the break time, one thing which is absolutely prohibited is do not discuss the paper one. This is very, very important. The biggest thing is that when we come out of the hall, there are people who would like to start discussing the question of paper one. And believe me, you think the other person knows better than you. Whatever answer you have marked for that question, he or she would say, no, I have marked this answer. And you will start feeling that, okay, this question went wrong. You are not really, getting this idea. The other person is also exam going student only, or do not think that your answer is wrong, other answer is correct. So for that, the rule should be, let us forget about paper one. Let us look at paper two. Is another 150 question coming on your way. God forbid, our paper one has gone little weaker. God forbid. Paper one goes weaker and you are not sure how the paper was. And generally, you are not sure how the paper was. Easy, difficult. By the evening, only you get the idea of how was the question. Actually, you just attempt the paper one. You come out of the paper one after you come out of the hall, and you start feeling that I don't know how the paper went, but generally the feeling is not that great. But if you start discussing the question with other fellow friends, it might derail your momentum for the paper two. So let us look at paper two as another opportunity to score 150 questions properly. By chance, paper one did not go that great, and you scored only 72 marks out of that. For example, I'm saying, or 70 marks out of that. Don't you think so? In paper two, you can score 80 marks and pass the exam. Okay, you score 65 in paper one. God forbid, I think 65 you scored only. Still, you in the paper two can score 90 marks and pass the exam. Better still, the only problem is people come out in that 1 hour 15 minutes. 15 minutes you should eat, have coffee in the beginning only. In the beginning. After that, you sit down. As sir said, you see the images, see the staging, classification, anything one-liners which you have got from institute or whatever it is. And then don't talk. Don't waste your energy. Save it for the paper two. It's coming. And let us go on right time at 1 o'clock, enter the hall, sit down over there, look at 150 question. Oh, don't worry. I scored 70 out of the first paper one, maybe most probably. It's okay. I will score 80, 85 and pass the exam comfortably this time. That kind of approach should be maintained. So no discussion between paper one and paper two. That's the most important thing. We will not do that. Okay. Let us not ask anyone. This question, nobody should ask anyone, paper one kaisa hua? Ye wala question nahi puchna hai. Kaisa hua paper? Paper kaisa hua will be discussed in the evening. Okay, fine.
Very well said, Rajiv sir. Just to crisply send a message, what you have tried to communicate, that whatever is paper one, whether it is an easy paper or a difficult paper, you're not going to discuss anything. If it is an easy paper, do not become overconfident. If it is a very tough paper, do not get frustrated or bogged down by the feeling of the paper one. Just try to maintain a calm composure inside you.
Yes, absolutely, sir. Absolutely. So, anything you would like to, people can carry paper and pen, sir, in the exam?
No, they are not allowed.
Paper and pen is not allowed. Are they allowed any kind of watches, any kind of digital analog watches?
No watches, no metallic thing, nothing. They
So
cannot.
do not carry that.
Anything
Okay. Yeah.
also.
Yeah. Sure. Sure.
Even
Okay.
girls,
And
please make sure that you're not wearing your earrings, right? Or even that the
Bowspin.
yeah,
Yeah. So
nothing.
metallic things should not be taken inside. So that's why it will be, better to really go as minimalistic as possible on that day. Otherwise, you'll be having, yes, mobile will be there. You can keep it on the bag outside, or somebody's there with you. Or if you're going with a vehicle, you can keep it in that. I know you will be carrying the mobile anyway with you.
Also, I would like to request the students to carry some basic medicines with them, like maybe paracetamol or diclofenac, or maybe a combiflam type of thing, or maybe a anti-vomiting tablet, anything what you prefer, or an antacid. These are some basic medicines, so that if anything of that type happens, then you can just take that pill.
Yeah.
They are not
How
going
to
to
handle
take
the
any.
anxiety better? How to handle the anxiety is a very important thing actually, and I think the most now, right now, from this moment onwards, let us change the mindset. The winning mindset is that I have really studied a lot. First of all, I never studied this much in last 6 years of my medical college university. Last 6 years one side, these 4 5 months one side. It. Let us feel good about our attempt to prepare the exam in a proper manner. I know it's not perfect. It's not perfect. You could have done better. You could have wasted less number of days. You could have slept lesser. I know that everybody does like that, beta. But in this feeling of imperfect preparation lies the perfect path to pass the exam. Beta. I know the feeling is imperfect. Oh, I could have done better. But don't you think so? University 6 years are on one side, these 4 5 months are on one side. You have really tried to do your level best, and that is what which matters right now. And if you are saying that Rajiv, we forget these things, we are not able to recall it, it's there in your brain, beta. It's there in your brain. This paper is not a subjective paper. It's an objective paper. Subjective paper means essay writing competition, beta. Tell me the name of syndrome which has got autosclerosis into it. You may not be able to recall any syndrome which has got autosclerosis, but if I flash on the screen one question, you may be able to Van der Hoeve syndrome. It's there in our notes, for example. It was there in autosclerosis actually there. So this data on the screen has to be matched with the data in our brain. It's objective. It's objective data. So have faith. When you try to recall, how do you recall? 10 causes of heart failure. You close your eyes and you say 1, 2, 3. After that, 4, 5, 6, you don't remember. And you start with, I just read 48 hours before, and I'm unable to recall the fourth cause of heart failure now. Only 3 causes I am able to recall. So then you start feeling low. But my question is, are you going to get this kind of paper in the exam? Write down the 10 causes of heart failure, 1, 2, 3, 4, 5. No, the paper would be one of the following is not a cause of heart failure. Then you'll be able to recall that in your brain. There's a data in the brain, there's a concept in the brain. Okay, this is not going to cause it actually. So have faith in yourself. A very important thing is have faith in yourself. You know it. It's there in your brain. You are trying to recall it in a little, I would say, different manner. That manner is not going to be used in the exam. It's not an essay writing or subjective paper. Objective means data in front of you, data here to be analyzed and matched and answered. And I would again say, if you do not know a question, there'll be series of questions. Like, can you imagine you are switching on the screen paper 1, first question, and you just do, that I should know it. And suddenly you see that, oh, I don't know this question, you know what? And from there, the story will start. Remember ECG. ECG is like this. Now, ECG, I told in the previous, this one, ECG like one small beat, one upbeat, one small beat, one flat line in between. So that's how the paper is also. The upbeats are the question which you know, and the small waves are the question which you partially know, and the flat lines are the question which you do not know. But it keeps on going like that. It keeps on going like that, beta. Keep in mind the paper will be like an ECG, beta. ECG. Have faith. ECG means you are alive. You'll keep kicking at the end. Actually, it's not a flat line. It's not a flat line. It's still coming. Some of the question, oh, it's a peak. I know it. Some of small peaks mean, oh, I partially not sure, but I'll mark it. Flat question, unknown question, remember my face over there. I always say, why I say my face? Not Dr. Vineet's face or anybody's face, I would say. Why I say my face is that, this I really use in my own exam also. And some of the question you want to really, in spite of negative marking, you want to crack it, then I would just say, okay, fine. And I really saw that out of 10, 2 you can score like that also, like that, minimum. So have faith, ho jayega, kar lenge, baat ban jayegi, confidence rakho, be fearless from this moment, not careless, fearless. Be fearless from this moment that I'm going to make it happen. I'm going to make it happen. From this moment, I'm not going to predict what will happen on the exam day. I'm going to revise as much as possible. On the exam day, I'm going to already know that I will not be knowing a lot of things, but I will keep on maintaining the momentum till the last question is submitted. And if I do not know a question, I'll remember his face and smile and mark the most beautiful answer and go to the next one. I remember ECG. ECG. It's like paper is like ECG. But ECG means patient is alive. We are also alive. We'll keep kicking.
Wonderfully said, sir. So I think the few questions which I would like to take up, that is regarding what would be there in paper 1 and paper 2. So I would just like to remind you that paper 1 would be having anatomy, physiology, biochemistry, pathology, pharmacology, microbiology, forensic medicine, PSM, ENT, and ophthalmology. However, there would be few questions from PSM, ENT, and ophthalmology, which would also be asked in paper 2. So paper 2 generally would be having, as per the NB distribution, 10 questions from PSM, ENT, and ophtha in paper 2. Then medicine, surgery, ops and gynae, pediatrics, orthopedics, dermatology, psychiatry, radiology, and anesthesia. These would be there in paper 2. I'm really delighted, Areem, to see you on this platform. Thank you so much. You have been so close to us, and I know that you are doing well. Please keep that good work going. And I think OBG that you have revised twice, but still you are facing a big problem in the clinical questions. My suggestion, beta, OBG is definitely going to be one of the game changers for you. So please do not miss out. Try to re-revise it once again, beta. Those subjects which are really going to be high scoring, the input-output ratio is better. Please do not miss out on those subjects, which I think we have already
The
highlighted.
surgery, OBGY is very important. PSM gives a lot of questions, you know it. And try to see the images a day before and in between the break time also. Just see the images of surgery, radio, see the images in the break time. And a lot of people tell me that whatever they saw in the break time, the same thing were asked in the paper 2. So we know it what actually is going to be paper 2 dominating about. So I think seeing the images would be a good idea. Okay, but guys, do not change anything in the last 3 days. Whatever you've been planning, execute that only. You know it. What is the best thing for you? Do not keep on changing the plan. Okay, no. If you know surgery, just maybe 2-3 hours you see the surgery again. Focus on other subjects like OBGY is again very important. I told you, and but the only thing is that you already have in mind last 3-4 days, whatever you can see once again is going to be helpful in the exam.
Absolutely correct. And I think all the detailed plan has been shared earlier. Just to revise Glasgow Coma Scale for Aditi very quickly, because this is something which is very crucial. The eye verbal and motor responses, eye maximum 4, verbal maximum 5, motor maximum 6, minimum eye 1, verbal 1, motor 1, spontaneous eye opening 4, to sound or voice it is 3, to pressure pain it is 2, no response is 1, verbal fully conscious oriented to time, place and person is 5, confused is 4, inapt words is 3, incomprehensible sounds is 2, and no sound at all is 1. Motor obeys 6, localized 5, withdraws or normal flexion 4, abnormal flexion 3, abnormal extension 2, no movement at all is 1. So according to the grading, mild, moderate, and severe, 13 to 15 mild, 9 to 12 moderate, and 8 less than 8 is severe. Dead patient, it is 3. So I think break for surgery. So in surgery, basically, you have to just look at the images in the break time. And I think you can just go with the single line as what you are having, or maybe the highlighted points in surgery. And in the strategy, which I would like to specify here, Himavardhan Umesh, you have to just focus on the 5 points, just re-emphasizing them once again. Single liner questions, you know what you are supposed to do. The lengthy questions, you know. The image-based questions, you know. The conceptual questions, you know what you are supposed to do. And the questions which you don't know about, the rule of exclusion is going to be important out there. Thank you very much, Bita. And the students are really inspired by your thoughts. And may everyone passes the crunch line what the students are suggesting us. So Rajiv sir, I feel that may everyone pass. And
so
if
one question that they're saying that 50% altogether or 50% in each paper
No,
is 50% altogether. Better. For both, the good thing is 50% altogether in both the exam combined, paper 1, paper 2. That is what is required. Not individually, you need not really score paper 1 and paper 2 to pass it. Okay.
One more question.
Yeah, sure.
We need to answer is they should not wear any thread or anything, because that will create unnecessary turbulence for you, beta. So I think just be careful. And Kiran has rightly said that I'm going to qualify, sir, this time. And the entire team of MIST, beta, everybody, each and every faculty of MIST, just keep on praying, just keep on thinking that may all the foreign medical graduates crack this exam. And may you all come out with flying colors, beta. Just keep that confidence inside you. Just keep that bubble inside you. You know that the time has come. And these last 3 days, 3.5 days, you have to just devote yourself completely in revising beta whatever best possible you can do. You know the high scoring subjects, the PSM surgery, gynae, the ENT ophthalmology, the anatomy pathology, the forensic radiology. These are input output ratio. If you compare, these are going to be high scoring beta. Please do not miss out on them. And definitely you will come out with flying colors. As Rajiv sir is saying, keep on believing in yourself, keep on having faith in yourself, and you are almost there. You will be there. Nobody on this earth has the power to stop you. Just keep fighting for another 3.5 days and go for the kill.
Wonderful. Definitely. And I'll just say the last thing to all of you: keep praying for yourself, keep praying for your friends also. Pray for everyone. May everyone pass. And you all are very, very much eligible to pass because you have been doing a lot of hard work. If you have been attempting this paper second time, third time, just remember that every exam is a different exam, and you're very close to making it. Keep your morale, momentum, and confidence intact. That is very important. Last few days, do not think I did not do well in the mock test or that grand test or this grand test. It's immaterial, but the real exam is 12th December. Okay, on that day, just try to score as much as possible and keep the spirit alive within you till the last question is submitted. And everyone in team MIST is just wishing good luck to you, prayers for you, and best wishes for all of you. May everyone pass, and you all deserve to pass. Thank you very much.
Wonderfully said, sir. One question, last question, that you cannot come out of the examination hall before 11:30 if you have completed your exam before that time. Right, beta? So thank you very much. And we all wish you once again a very, very good luck to all of you. And let's see you on 12th evening or maybe after that. God bless you all. Wish you all the best.
Thank you, sir.
Thank you. Thank you, sir.
Thank you, sir.
And thank you to all the students for showing so much of faith and belief in us. Thank you.